for the bony is strengthen kidneys and bones, relieve pain, and strengthen core. So today's presentation, we will go through a few parts. First is the skeletal systems. We will go through our human skeletal system. And then next is the types of bone diseases. Actually, bone diseases have many types. So we will go through one by one. Benefits. Then we will go through the directions for use and the storage method of this bony. And last one is the common questions of the bony. So first, we will go through our human skeletal system. So our human skeletal system, right, actually is composed of bones, cartilage, ligaments, and other tissues. Adults like us have 206 bones, while newborn baby has as many as 305 bones, which means that the newborn baby has more bones than adults. So when we move, right, when we do some movement, we can feel how the bones support our body and promote the limb movement. In the meanwhile, protect our internal organs from harm by covering or enclosing them. Imagine if there is no skeletal system, which means if as a human, we have no skeletal system, we will become a mess of soft organs, muscle, and skin. At the metabolic level, right, the bone tissue acts as a reservoir of minerals, especially calcium and phosphorus. These minerals incorporated into the bone tissue and can be released back into our blood to maintain the levels required to support the physiological process. So bone is also a place for fat storage and blood cell production. The bone marrow has two types. One is yellow bone marrow and another type is red bone marrow. Yellow bone marrow contains the adipose tissue, and the triglycerides stored in the adipose tissue can be released as a source of energy for other tissues in the body as required, while the red bone marrow produces red blood cells, white blood cells, and platelets. So this is the simple information of our human skeletal system. Next, we will go through the type of bone diseases. So our bones, right, actually they act as like a bank for bone mass storage. So most of them are saved when we are young and a small amount is being spent. After the age of 30, we spend more than we save, especially in middle age and old age. So as we age, right, human bones begin to lose and the bones will become more brittle. So there will some problems will keep more occurring, like a backache, fracture, and other phenomena occur more frequently on our body. So on the whole, bone loss in women can reach 30% to 40% at the peak, and bone loss in males is 20% to 30%. So we can see that the bone loss in women, right, is more serious than the men. So next, we will go through some bone diseases which are quite common among us, especially adults and elderly. First is the osteoarthritis. Osteoarthritis is a chronic degenerative joint disease, the most common type of arthritis affecting millions of people around the world. When the cartilage of the tissue of the cushions ruptures and the bones rub together, osteoarthritis will occur, and then leading to pain, inflammation, and stiffness. So although osteoarthritis can damage any joint in our body, the disease usually affects our hands, knees, hips, and spine. So next is the osteoporosis. So many people have heard about this osteoporosis, and it's more prone to occur among women. Osteoporosis is a disease in which bone density decreases, bone become fragile, and fractures are prone to occur. Osteoporosis may not show symptoms until a fracture occurs. So that's why some people, they don't know they have osteoporosis until something happens like injury or accidents. When they go to doctor, go to hospital and check, then only doctor will tell them, oh, you have osteoporosis, this problem. So next is the rheumatoid arthritis, which is the simple form is RA. So rheumatoid arthritis is a chronic immunodeficiency disease in which our human system mistakenly attacks the body tissues, such as the joints of hands and the feet. So it's different with the osteoarthritis. Osteoarthritis is wear and tear. This is the reason that can cause the osteoarthritis, wear and tear. But RA, right, the rheumatoid arthritis, right, it affects the inner wall of our joint, causing painful swelling and even bone erosion and joint deformities. So next is the scoliosis. So based on the picture, you can see that it's actually the bones of the spine are abnormally bent to the left or right. It can be like classified as type C or type S, which usually occur before the puberty. So although most of the scoliosis cases are mild, in some cases the spinal deformities will get worse over time. So a genetic component is suspected, but until now, the cause of this scoliosis is still unclear. Next will be the bone tumors. So the bone tumors occur when the cells grow uncontrollably in bones. These tumors can be benign or malignant, but benign bone tumors are more common. And next will be the osteopenia, also known as low bone density, is diagnosed when a person's bone density is lower than it should be. Low bone density can lead to osteoporosis, which can lead to fractures, pain, and hunchback. So osteopenia is considered to be the midpoint of the osteoporosis. Next will be the gout. Gout, I think, is a very common. Many people know about the gout. It's a common disease in which the excessive amounts of uric acid crystal accumulate in our joints, causing the abnormal swelling, pain, and redness. So it usually happens in our big toe, because it can, like, you can noticeably the big toe swollen, very painful. But actually, other than the big toe, right, other joints may also have the symptoms, including the ankle, foot, or knee, or even more serious is the fingers. So gout may occur due to the diet, or because maybe the kidneys cannot process the uric acid properly, then the gout may occur. And the last one is the osteonecrosis. Osteonecrosis, in another words, is the bone death, which means the death of the bones. So without the blood, the bone tissue will die. Once the bone tissues die, the bones will weaken and collapse. That's the osteonecrosis happen. So next, we will go through the factors that cause the bone diseases. Actually, the factors, right, for all bone diseases is like quite similar. There are some similarities among the bone diseases, their factors, but some are special for each of the bone disease. So first, we will look through the osteoarthritis. There are many factors that may increase the risk of the osteoarthritis. For example, the risk of osteoarthritis can increase with age, and then women are more likely to develop the osteoarthritis, although the cause is still unclear. And then obesity. The higher the weight, the greater the risk, as the extra weight of the body will put extra pressure on the weight-bearing joints, such as the knee. That's why it can lead to the occur of the osteoarthritis as well. In addition, the adipose tissue may produce proteins in and around the joints that cause the harmful inflammation as well. So if a person is injured in sports or accidents, it may increase the risk of osteoarthritis as well. And then even the injuries that occur many years ago and seem to have healed, recovered already, but still it can increase the risk of the osteoarthritis. And then genetic as well. Some people inherit the tendency to develop the osteoarthritis. And then certain occupations, such as some jobs that include the task that you have to put repeated pressure on a joint, then this joint may eventually develop into osteoarthritis. Next is the factors that can increase the risk of the osteoporosis. The main cause of osteoporosis is the lack of estrogen, especially after menopause. Estrogen will drop sharply. This is the reason that can cause the osteoporosis among the women. And lack of estrogen can increase the breakdowns of bones and then leading to the rapid bone loss. In men, Reduced levels of male sex hormones can also lead to osteoporosis. Not only women, but men also same. If calcium intake is insufficient or vitamin D level is very low, the bone loss may become more severe. There are many other factors such as certain drugs, smoking, alcohol abuse, family history of osteoporosis, and short stature can increase the risk of the bone loss and women's progression to osteoporosis as well. So these risk factors are also the same in men, not only women, but actually in men also the same for the cause of the osteoporosis. Next, we will go through the factors that increase the risk of the RA, which is the rheumatoid arthritis. So women, same thing. Women are more likely to develop the RA, the rheumatoid arthritis, than men, but still unclear why women is more prone to RA. Rheumatoid arthritis can occur at any age, but it's more common in middle age, which is like 40 plus, 50 plus is more common for people to develop the RA. If a member of your family has a RA, your risk of developing this disease may increase as well. And then some living habits such as the smoking can increase the risk of RA as well, especially if you have a genetic predisposition for this disease. And then for those who are overweight, also have a higher risk to develop this RA. So next we'll go through the gout. What are the factors that can increase the risk of the gout? So if a person has a family history of gout, or he or she has a kidney problems and drink a lot of alcohol, he or she might develop the gout as well. It's more prone to develop the gout. And then excessive intake of certain food can increase the level of uric acid in the body as well, such as the animal organs, some seafood. This food, right, will increase the uric acid in our bodies. And in the same time, if the kidneys cannot process this uric acid properly, right, this person will more prone to develop the gout. And then other causes is like taking some medications, or being overweight or obese, having some metabolic diseases such as the high blood pressure, high blood sugar, they are more prone to develop the gout as well. And then for osteonecrosis, osteonecrosis occurs when blood flow to some bones is reduced. Many people don't think that bones are alive. They think that bones are dead cells, but actually bones are actually living tissues. So they need blood supply to transport the oxygen and nutrients like our other body cells. So without the enough blood, right, the bones will die, and then the decrease in blood flow to some bones may be caused by trauma or occurring spontaneously will cause this osteonecrosis as well. And then some people, if they have the prolonged use of the high doses of steroid hormones and drinking alcohol, can reduce the blood flow to some bones as well. Once the blood flow to some bones reduce, the osteonecrosis may happen. And the last one is the osteopenia. Same again, women are more prone to develop the osteopenia, and then Asian and Caucasian descent are at a higher risk of the osteopenia as well. And then for those who are over 50 years old, or women already menopause, or develop the menopause before the 45 years old, can have the osteopenia as well. And if the person, no matter it's men or women, if they're not getting enough exercise during young or during middle age, always a lack of exercise, and then having a poor diet, especially lack of calcium and vitamin D, and then at the same time have the smoking habits, drinking too much of alcohol, these all factors will contribute to the osteopenia. So next we will go through the Boney, which is our product. According to the traditional Chinese medicine theory, right, the kidney actually it is the congenital constitution, and the kidneys governs the bones to produce marrow, which means that the kidney essence has the function of promoting the growth and development of bones. And then decrease the renal function directly can affect the changes in bone tissue structure, leading to bone loss, articular cartilage degeneration, osteoporosis, weak bones fractures, or uneasy healing after fractures, which indicates that our kidneys and the bones are actually closely related. The tips of strengthening bone is to nourish the kidneys, which means that healthy bones are based on healthy kidneys. If our kidneys are healthy, then only our bones will be healthy. This is the relationship between the kidneys and the bones as according to the TCM concept. So for adults, if they have weak bones, there are some symptoms can be seen in their daily life, which means that their leg always no strength, have some weakness, and then they cannot walk properly, and then they always have the back ache, or even more serious one, they cannot move properly. And for elderly, right, if their bones are unhealthy, then they might develop some bone diseases. The most common one is the osteoporosis, the osteoarthritis, and their bones are prone to fractures, and even their teeth also will be affected, like the teeth will loosen and teeth falling off. These are the examples of an elderly that has some weak health problems on their bones. So for TCM and modern medicine, right, they have their own concept on the bone health. So in TCM, the bone strength, they mentioned that in TCM, the bone strength is closely related to the kidney essence. But for modern medicine, right, they say that tonifying the kidney can accelerate the absorption of calcium and quickly relieve a series of symptoms caused by calcium deficiency. If the kidney function is good, the whole body will function properly and the nutrients absorption will be comprehensive and rapid. So these are the difference of the bone health concept between the TCM and the modern medicine. But still there are some similarities is that kidneys and bone health is closely related as well. So Boney's, right? Boney's, there are 4 main ingredients in Boney. First is the Cibacton seed oil, and the second is the Transhuman rhizome. The third one is the Substantia discerticola, and the fourth one is the saffron. So now we will go through each ingredients and see what is their functions and what is their benefits to our kidneys and bone. First is the Cibacton seed oil. Cibacton seed oil, it provides the cell energy, stimulates our cell vitality, and promotes the repair and regeneration of the cell tissues. It can effectively scavenge the free radicals, antioxidation, anti-allergy, and improve our cellular immunity. So at the same time, the Cibacton seed oil also can quickly reduce the inflammation and relieve the pain against the aesthetic inflammation, effectively dredge the meridians, enhance the qi and blood, and at the same time reduce the joint pain as well. And the next ingredient is the Transhuman rhizome, is a type of Chinese herbs. So this Transhuman rhizome, right, is rich in niacin, polysaccharides, various amino acids, vitamins, and trace elements. So it mainly clean our blood, improve the bone microcirculations, increase the bone blood flow, and at the same time provide sufficient nutrients to the bones and promote the metabolism and supplementing the calcium and phosphorus to our bones. These Chinese herbs, it can improve the bone nutritional status, remove the bone waste, repair the damage and the aging bone cells, fundamentally solve the bone quality, achieve the purpose of strengthening the bones and increasing the bone density. The third main ingredient is the Substantia discerticola. This ingredient, it can enhance various indexes of the bone tissue, and it promotes the bone regeneration as well. It nourishes the kidney and the bone and then strengthen the yang without affecting the yin, because in TCM there's a yin and yang, right? So this Substantia discerticola, it can strengthen our yang without affecting the yin, and then nourish our intestine, regulate the organ functions, promote the absorption and utilization of the calcium by the bones, quickly eliminate a series of symptoms caused by the calcium deficiency, and strengthen our muscle, making our bone and muscles both also stronger. And the last main ingredient is the saffron. So saffron is a flower after processing, right? After drying, it look like a red color flower. So this saffron, it can keep our renal capillaries dilate, increase the renal blood flow, and promote the repair of the inflammatory damage. It's a good medicine for invigorating the blood and qi, promoting our blood circulation and removing the blood stasis. And it can improve the symptoms such as the sprains, fractures, and early femoral head necrosis as well. So these are the main functions, main benefits of these 4 ingredients in the Boney. So after this presenting the main ingredients of the Boney, now we see the top 10 health benefits of the Boney. So Boney is like the concept, it nourishes our kidneys, right? So it can enhance the renal functions, and then it can strengthen the activity of our bone cells and the number of bone cells, increase the bone density, maintain the stability of the bone mass, and further accelerate the absorption of the collagen while shortening the absorption. The Boney will make the number and the activity of bone cells reach a dynamic balance and the stability. And it can eliminate the joint inflammation like the osteoarthritis. It can reduce the symptoms of the osteoarthritis and relieve the symptoms. And at the same time, it can relieve the joint pain as well. The next one, the Boney also can repair our cartilage tissue, because cartilage tissue is a part of our skeletal system as well. Not only cartilage tissue it can repair, but also collagen and bone cells. And Boney is a good aid in the treatment of bones and joints. Finally, the Boney can nourish our kidneys and bones. So the main concept of Boney, this product, is it nourishes our kidney first, then only our bones will be healthy. This is the concept of the Boney. So next we will see how to consume this Boney. So for the directions for use, right? If you are just want to do some basic healthcare for your kidneys and bone, we will recommend you to take 2 capsules every day, 1 in the morning with empty stomach and 1 at night before sleeping. For those who want to do some advanced healthcare on their kidneys and bones, we will recommend them to consume 4 capsules every day, 2 in the morning in empty stomach and 2 at night before sleeping. Remember to consume the capsules with the warm water. So for the storage of this Boney, please store it in a cool and dry place and avoid the direct sunlight. Last part, we will go through the FAQ of the Boney. Boney is not recommended for pregnant women and nursing mother because they have sensitive physique. So if the pregnant woman and nursing mothers, they want to replenish the calcium for their body, they may consume shaji oli, because shaji oli is suitable for everyone. Even kids, pregnant women or nursing mother also can consume the shaji oli, but not the Boney. So for those 80 years old onwards, they can start consuming the Boney, and it's a vegan, so vegetarians also can consume this Boney. And for child, if he or she has a bone injury, he or she can consume the Boney, but remember, it's in small amount only. Just 1 capsule per day is enough until recover. And women can consume the Boney during the menstruation because it has no effect on menstruation. It won't affect our blood flow or any menstruation during the menses time. And there's no any reaction after taking the Boney. And then for those who may think that whether they need to consume the Boney for long term or not, it's actually according to all needs. For elderly or patient with some bone problems, like I mentioned just now, some bone diseases like osteopenia, osteoporosis, osteoarthritis, scoliosis, and other some bone diseases, if he or she have some bone issue, it's recommended to take Boney for long term for healthcare purpose. And for those who have no any significant health bone issues, they just want to do some basic health maintenance to prevent they develop the bone diseases, they can consume the Boney consecutively for 6 months and stop for 3 months before continue taking it to increase the effectiveness of the product. And then there are many questions asking, many people asking, what's the difference between Boney and Shaji Oli? Because both also like say that it's for bone health. Actually, the main difference is Boney, it repair the bones and joints by conditioning the kidney. When kidney is healthy, then only your bones, your joints will be healthy as well. And then Boney is suitable for adults and the elderly. While for Shaji Oli is a natural source of calcium because of the oli contents in this product. So Shaji Oli, it can replenish the nutrients needed by our human bones, especially the calcium and the phosphorus. And since Shaji and Oli, they are both fruits, so this product, Shaji Oli, is suitable for all ages, suitable for kids 3 years old and above, or even nursing mother, pregnant women also can eat this Shaji Oli. And then some people may asking if they are taking some Western medicine or TCM medicines or other health supplements for bone healthcare, whether they can take the Boney or not. Yes, can, but remember to consume at least 1 hour apart between the other products and the Boney. So that's all for today's topic, Boney. So as mentioned again, the concept of this Boney is nourishing the kidney first. When your kidney is healthy, then only the bones and joint, the cartilage will be healthy. So that's all for today's Boney topics. So thank you, everyone.